a year ago, I weighed 200 pounds. Well, before I tell you this, I'm going to tell you one other screwy story. This is a true screwy story. A couple of years ago, my wife traded in her Honda. She had gotten 200,000 miles out of it, and it started getting expensive to repair. So she traded it in. I said, you know, we're wasting money on this, let's get a new Honda. And naturally, she's expecting to get 200,000 miles out of the new Honda. Now let's say when she bought the new Honda, the dealer attached a second Honda with the tow bar. So her Honda engine is pulling two Hondas. She's not going to get 200,000 miles, she'll get 100,000 miles. It's doing twice the work, it's going to wear out in half the time, twice as fast. That makes sense, right? Okay. I'm going to slip in some things that don't make sense to see if you can catch me, okay? But that makes sense, right? Okay, a year ago, I became diabetic for the first time in my life, and I weighed 200 pounds. Now, I know that my lean body weight is 160, because that's what I weighed when I got married. That means I was carrying 40 pounds of fat. Okay. Lean body tissue requires 1/4 unit of insulin per pound per day. So my lean body requires 40 units of insulin a day. And God, or nature, programmed my pancreas to make 40 units a day for 80, 90 years, normal human lifespan. Now, fat tissue is different. Fat tissue is resistant to insulin. Fat tissue requires 1 whole unit per pound per day. So my 40 pounds of fat added another 40 units of insulin to what my body needed every day. So my poor pancreas had to make 80 units a day for the 30 years I was overweight. And my pancreas got pissed off or got worn out. It was making enough insulin for 2 people. That's not the deal. The deal was make it for 1 person for 90 years, not 2 people. And at the age of 70, a year ago I was 70, my pancreas started wearing out. It said, I can't make 80 units a day, it's not fair. It made less. I don't know exactly how many less, but it made less than 80, so my cells didn't get all the energy they needed. And my cells thought that I skipped a meal, so my cells sent a chemical message to my liver to release more sugar, and my sugar level went up to the diabetic range. Incidentally, it doesn't help you if you're diabetic to have the higher sugar, because it's insulin you lack. You can't pump that sugar into your cells. Now, because I'm a physician and I've taken care of so many diabetics in my life, and I know all the bad things that can happen to them, I decided I want nothing to do with diabetes. So I started losing weight, and I got my weight down to 180. So at 180, I still have 160 lean pounds that requires 40 units of insulin, but I have only 20 fat pounds. And the 20 fat pounds only adds another 20 instead of another 40. So now my insulin requirement's only 60 units a day, and my pancreas can handle that. So I'm no longer diabetic. I lost my diabetes by losing 20 pounds. Now I'm trying to lose another 20 because I'm still overloading my pancreas, and eventually it'll wear out again, maybe 10 years from now. And I don't want it to do that, so I'm working on the last 20. And this is going to come as a shock to you. You ready? You belted in? It's really hard to lose weight. Sorry I had to tell you guys that. We tried to keep this until the end of the program. It's really hard.
So
but
it's been most patients that get early diabetes or
they'll lose their diabetes. Every patient will either, if they have mild diabetes, they'll lose it if they lose weight. If they have severe diabetes, they won't lose their diabetes, but they'll need less and less insulin as they get rid of the fat. Now here's something else interesting. When I exercise, my skin pores open up and sweat comes out. And in a similar way, when I exercise, the pores in my muscle cells open up, and glucose can go in without needing insulin to pump it in. So right now I need 60 units a day, but I try to exercise for an hour every day. If I exercise today for 1 hour, I'll need only 50 units today. So that's a way of resting my pancreas and a way to be less diabetic.
Same concept with a low glycemic foods, or if you go into ketosis, will that be the same concept?
That's a little different. I don't want to go into that, because that's true, but that's not, it's a little different, and that makes it more complicated. So doctors say to diabetics, lose weight and exercise. Now, I'm a doctor and I know all this stuff, but supposing I'm not a doctor, and I go to my doctor and he says, well, you should lose weight and exercise. I'm very polite, like not politely. I'd walk out and I'd think, screw you. You lose weight and exercise. That doesn't sound like fun. But when you understand the reasons for it, it's a lot easier to do it. So that's a connection between obesity and diabetes. Most overweight people will eventually become diabetic. And there's an epidemic of diabetes in this country. Why? Because we have an epidemic of obesity. Any questions about any of this? No? So that's why we tell diabetics lose weight and exercise. If you're a mild diabetic and you lose a bunch of weight, you will no longer be diabetic. You lose your diabetes, which is a dread disease. Pardon?
Do you also tell them to change the diet?
Well, the foods you eat is important too, but I don't want to talk about that today because other people are going to be talking about that, and I don't want to steal their thunder.
Okay.
Then you won't come to their lecture.
Okay.
But that's the connection. Lose weight and exercise.